Hi, this is Neil Hansen, and I'm taking you through a liver donor protocol CT and MRI. Frequently at our institutions, individuals will be altruistic and decide to donate part of their liver to a loved one. To evaluate their candidacy to be able to do this, we need to thoroughly investigate their biliary system, arterial system to the liver, and venous system to make sure they don't have any anatomic variants that would preclude their candidacy for giving part of their liver. Usually they're giving the left lobe of their liver or the left lobe lateral segment to someone, so that's of particular importance. We usually do a CT to evaluate the arterial and venous system, and an MRI to mostly evaluate focal liver lesions and the biliary system. So here's the CT scan. It's usually done as a multiphasic study. First we get an arterial phase, and it's important to evaluate specifically the hepatic arteries. So you want to come off and evaluate whether the hepatic artery gives rise to both the right and left hepatic arteries, as in this case, or if it only gives rise to one of them. Frequently you'll see replaced or redundant or accessory hepatic arteries go through here. This is the fissure for the ductus venosus, and this person has an accessory left hepatic artery, so that's a vital important to mention so that the surgeon knows that part of the arterial supply of this left lobe lateral segment comes off of, in this case, the left gastric artery along the lesser curve of the stomach. Additionally, I always look particularly close at the superior mesenteric artery because frequently the right hepatic artery will arise off of the SMA. The next phase in the donor protocol CT scan is the portovenous phase, and that's where you're looking at the portovenous system. So you want to always look at the right portal vein, see where its posterior and anterior branches come in. Sometimes I'll even measure how much of the right portal vein length there is between the anterior and posterior division and the confluence with the left portal vein. And then you want to look at the left portal vein and just make sure there's no early branching into medial and lateral segments or other anatomic variants. I've seen a couple portal veins that are actually trifurcations where people are born with a right, middle, and left portal vein, which would significantly alter the surgical approach. So I always look at left and right portal vein, look for variants, and then look at the main portal vein. The last phase of the multiphasic scan is often taken a couple minutes after the arterial and venous phase, and this is just to focally characterize a liver lesion. Again, hemangiomas sometimes can be hard to diagnose based off of just their arterial and portovenous appearances, so you get this delayed scan in case you have a focal liver lesion like a hemangioma to make sure it fills in. You can look at the arterial and venous vasculature on the MRI also. However, MRIs tend to be prone by artifact in terms of respiratory motion, so sometimes seeing those tiny accessory left hepatic arteries can be very difficult, although I always double check on the MRI. The MRI is mostly used for the biliary system. However, I also find looking at the hepatic veins is sometimes easier on MRI, and even if the contrast study doesn't look great, like here I'd argue it's very hard to see the hepatic venous confluence, you can bring up your T2-weighted images, and in your average healthy person, if you window it correctly, you can see them here as signal voids, so we can definitely look at the left, middle, and right hepatic veins. You're looking for any accessory hepatic veins which drain, especially, like I said, the left lateral segment of the liver. What you want to focus on the MRI is the biliary anatomy, and so we get a series of Mrcp images. Here's a coronal Mrcp. This is kind of a single shot image, and you can see here that the right posterior duct inserts on the left hepatic duct. Unfortunately, in this case, that actually precludes the person from donating any part of their left lobe of their liver because they're at risk of having this right posterior duct injured. But that's the kind of thing you're looking for. We always do a 3D MRCP. Sometimes it can be very hard to tell what one of those individual ducts are coming from. So here you can actually scroll through the biliary system and get an idea. And if I start here anteriorly and scroll posteriorly, you can tell that this duct that I highlighted actually goes to the right and posteriorly, draining the right posterior lobe of the liver. We also do 3D reconstructions of that, so you can go through and more definitively assess where these small branches are coming from. Additionally, basically an entire liver MRI is obtained with T1, T2, and post-contrast images. So if there are focal lesions in the liver, like a hemangioma or a cyst, you can most definitively characterize them. There are some liver lesions, like adenomas, which may preclude someone from donating part of their liver, depending on what they are. Obviously, if they were worrisome for malignancy, and depending on the adenoma, how big or aggressive it appeared, that could alter surgical planning and or preclude someone from donating their liver. These are big studies that are considered kind of high stakes because we don't want to hurt someone that is being altruistic, and as such we report them in a lot of detail. So if you do one of these cases, bring up in PowerScribe our reporting template. You have to do liver volumes, which is kind of taught in a totally separate video. But you have to provide the surgeons with the whole liver volume, the right hepatic lobe volume, the left lobe volume, and the left lobe lateral segment. Additionally, I always comment on the liver parenchyma. In other words, are there any focal masses and what do you think they are? Talk about the specific branching of the hepatic arteries, hepatic veins, and portal veins, as well as describe any anatomic variants of the biliary system. If you do one of these cases, it's best just to bring up the template for them so you make sure you don't forget to mention anything. Because if you forget to mention something, I guarantee I will get a phone call about it.